Amarillo Oral and Maxillofacial Surgery offers a variety of cosmetic procedures to improve your overall appearance, skin consistency, and self-confidence. Chanel from AOMS joins us today to talk about the differences between lip filler and a lip flip. First of all, I've heard of lip filler, but not a lip flip. What is that exactly?
So lip flip is where we use Botox to relax the muscle, the orbicularis oris that surrounds the mouth, to flip the lip out, so you have more appearance of your upper lip.
Okay, now filler is just what makes it larger, right?
Yes, so filler is hyaluronic acid, where we can fill in areas of the face like the cheeks, nasolabial folds, and the lips. So yes, the lip filler, we fan the filler, a gel-like substance, into the lips to add more volume.
Okay, now then, the Botox one is much easier, right?
Yes, quicker, cheaper, easier. It doesn't last as long, 3 to 4 months, as opposed to lip filler, which typically lasts 9 months to a year.
Okay, very good. So we've got some before and afters, and I think that's going to be really, it's going to help us to really illustrate this for you. Okay, so let's take a look at this first one. Talk us through this. What are we seeing?
Okay, so the top picture is the before picture, before her Botox. That's Botox only, no hyaluronic acid or filler. So her ratio is pretty off in that picture, like 10-90 or 20-80%.
Meaning?
Upper lip to bottom lip ratio.
Okay, got it.
A lot of people like a 40 to 60% ratio of the upper lip to bottom lip is what's known as most natural. And so you can see her upper lip's a lot thinner. So I just did 8 units of Botox in her upper lip, and within days the muscle had relaxed enough to make that much of a change.
That's so interesting.
Yeah.
And that's an easy fix.
5 minutes. Yeah.
Wow. Okay, let's look at the next one.
This one is also Botox, a conservative amount. I think we did 6 units there, and as you can tell in the top lip, when she smiles, her upper lip gets sucked away to where she has none showing. So about 2 weeks later is her bottom picture, and you can tell when she smiles, she still has some body of the lip showing, so she can smile more confidently without just having no lip showing at all.
That's so good. Okay, now these I assume are going to be more of like the fillers.
Yep. So on the left is the before pictures, and the right is the right after. And this was my own patient's photos that she sent to me, so she's a little bloody. That was immediately after. So you can tell there's full enhancement of the upper and immediately. Yeah. So you don't have to wait for the Botox to do its job on the muscle. The filler is going to be immediate. So that's as soon as we injected the hyaluronic acid into her lips.
Now, is either more safe or?
And Botox is definitely more safe. So with filler, especially in the lips, if you're prone to fever blisters, that can start up a fever blister as well. So we pre-medicate for that. And then there's always the risk of occluding a blood vessel with filler. So never had that happen, but that is a risk. And then bruising is also pretty common in the lips because of it's so vascular.
Okay, we've got one more before and after, so let's take a look at that one.
Okay. Yep, so the left is her befores and the right is after, and this is filler again. So you can see how with the filler we're enhancing the whole lip. It's not just changing the way the muscle works in the lip. So the top, of course, is at rest, and her lips look much fuller on the bottom and the top. And then the middle is smiling, of course, and the bottom's her side profile. So some people really want to change in their side profile when they don't have any lips showing at all, and you can tell how that added actual volume to her lips.
Really interesting. Okay, well now we know the difference between filler and a lip flip. And if you want to know more, give our friends over at AOMS a call. They can help you schedule an appointment, things like that. And you can help them determine what's best for them, right?
Yes, some people come in expecting to do one thing, not knowing there's other options, and there's different options of filler as well. So you can start with a real thin filler that's not going to be so significant and make such a change if you're a little nervous about it, or a thicker filler like Juvederm Ultra Plus is my favorite, and that really gives the fullness to the lips.
All right, very good information. I learned a lot today. We appreciate you. Stick around, everybody. We're going to head into the kitchen with